its course and relations in the forearm. Before we go into the course, let us have an overview of the flexor compartment of the forearm. So these are all the long superficial flexors of the forearm, which are the pronata teres, the flexor carpi radialis, palmaris longus, flexor digitorum superficialis. Once these superficial flexors are reflected, then the flexor digitorum profundus is exposed. So as this ulnar nerve from behind the epicondyle posteriorly, as it enters into the front of the forearm between the two heads, that is the ulnar and the humeral head of the flexor carpi ulnaris, it rests on the flexor digitorum profundus under cover of the flexor carpi ulnaris. So this is the flexor carpi ulnaris, the medial most muscle. So this is the cut part of the flexor carpi ulnaris. It is cut because as it is covering the ulnar nerve, to expose the course of the ulnar nerve, the flexor carpi ulnaris too has to be reflected. So now as the ulnar nerve enters into the front of the forearm between the two heads of the flexor carpi ulnaris, it rests on the flexor digitorum profundus. So in the upper part of the forearm, the ulnar nerve is deep to the flexor carpi ulnaris, whereas in the lower 2/3 of the forearm, it passes subfacially lateral to the flexor carpi ulnaris tendon and is related to the ulnar artery, which is lateral to the ulnar nerve. And this ulnar nerve, accompanied by the ulnar artery, enters into the palm lateral to the pisiform bone, superficial to the flexor retinaculum. A thing to be noted here is the pisiform bone is a sesamoid bone which is formed within the tendon of the flexor carpi ulnaris. So this ulnar nerve enters into the palm along with the ulnar nerve lateral to the pisiform bone and superficial to the flexor retinaculum, whereas the median nerve goes beneath the flexor retinaculum. So the branches it gives in the forearm, because in axilla and in arm there are no muscular branches that are given by the ulnar nerve. So here in the forearm, it gives muscular branches to the flexor carpi ulnaris and the medial half of the flexor digitorum profundus, where its tendons go to the ring and the little fingers. The fibers that are conveyed to the flexor carpi ulnaris also have the fibers that are coming from the C7 root along with C8 and T1, whereas the rest of the muscles that are supplied by the ulnar nerve carry fibers conveying from the C8 and T1 roots only. So in the forearm, in the lower part of the forearm, there is a branch, a cutaneous branch, which is called as palmar cutaneous branch, which descends down along with the ulnar artery, related to the ulnar artery, superficial, here you can see, superficial to the flexor retinaculum, to supply the skin over the hypothenar eminence. There is another cutaneous branch which is called as dorsal cutaneous branch of the ulnar nerve, which arises about 5 centimeters above the wrist, passes dorsally deep to the tendon of flexor carpi ulnaris. This is the flexor carpi ulnaris. So it is passing deep to the tendon of flexor carpi ulnaris and appears in the dorsum of the hand after piercing the deep fascia to supply the medial part of the dorsum of the hand along with the dorsal aspect of the medial 1.5 fingers. So here we can very clearly see the cutaneous branches which are given in the forearm by ulnar nerve. So this is the palmar cutaneous branch which is given in the lower part of the forearm, where it passes along with the ulnar artery, superficial to the flexor retinaculum, to supply the skin over the hypothenar eminence. Little proximal to the origin of the palmar cutaneous branch, there is another cutaneous nerve which is called as dorsal cutaneous nerve of the ulnar nerve. It goes under cover of the flexor carpi ulnaris and piercing the deep fascia, it appears on the dorsum of the hand to supply the medial half of the dorsum of the hand and the medial 1.5 fingers. And here the ulnar nerve, it gives articular branches to the wrist joint and the carpal joints, and also proximally to the elbow joint, and vascular twigs to the concerned blood vessels. At wrist, so to have an overview, we are concerned with the medial half here. So this is the palmaris brevis. These are the hypothenar muscles. These are the tendons of flexor digitorum superficialis, beneath which is the flexor digitorum profundus to the ring and the little fingers. And this is the flexor retinaculum. If we see in this picture too, this is the flexor retinaculum and this is the pisiform bone. This is the ulnar nerve. Superficial to the flexor retinaculum, you can see the palmar cutaneous branch. This is the dorsal cutaneous branch which is going beneath the flexor carpi ulnaris to appear on the dorsal aspect of the hand. A thing to be noted here at wrist is the flexor retinaculum gives a slip which is attached to the pisiform bone, passing superficial to the ulnar nerve, creating a tunnel which is called as Guyon's canal. On the lateral side also, it gives a deeper slit, the flexor retinaculum, which is attached to the crest of the trapezium, through which the flexor carpi radialis tendon passes. Here on the medial side of the flexor retinaculum, it gives a superficial slit which passes superficial to the ulnar nerve, being attached to the pisiform bone, forming a canal through which the ulnar nerve along with the ulnar artery passes into the hand beneath the palmaris brevis, which is called as Guyon's canal. So on to the distal border of the flexor retinaculum, which corresponds to the proximal part of the hypothenar eminence, this one, the ulnar nerve will be dividing into its terminal branches, the superficial branch and the deep branch of the ulnar nerve, where they divide beneath the palmaris brevis, superficial to the flexor retinaculum, but are covered by a superficial slip of the flexor retinaculum, which is attached to the pisiform bone, forming the Guyon's canal. What is Guyon's canal? So here you can see, this is the flexor retinaculum. This is the superficial slip of the flexor retinaculum, which is attached to the pisiform bone, superficial to the ulnar nerve and the ulnar artery. So this is also called as the ulnar carpal tunnel, or just the ulnar tunnel, or even the pisohamate tunnel, because this Guyon's canal is of about 4 centimeters long. It starts at the proximal end of the flexor retinaculum and ends at the distal end of the hypothenar muscles. All this is the Guyon's canal. So here we will see. So this is the flexor retinaculum. This is the pisohamate ligament, which is attached to the pisiform bone and the hook of the hamate. These are the hypothenar muscles. So as the ulnar nerve enters into the hand, it passes through the Guyon's canal, which extends from the proximal part of the flexor retinaculum, passing beneath the pisohamate ligament and the hypothenar muscles to the distal end of the hypothenar muscles. Whole of this is the Guyon's canal, which is about 4 centimeters in length. So this Guyon's canal is a semi-rigid canal. So let us see the borders. The floor is formed by the flexor retinaculum. The roof is formed by the superficial slip of the flexor retinaculum, which is attached to the pisiform bone, which is called as palmar carpal ligament or volar carpal ligament as well. Medially, it is the pisiform bone. Laterally here is the hook of the hamate. Here we can very clearly see. Medially is the pisiform bone. Laterally is the hook of the hamate. So there is a pisohamate ligament which is attached between the pisiform and the hook of the hamate. The Quion's canal has a single entry point, but it has two exit points, which is superficial and the other one is deep. So the superficial exit will pass the superficial branch of the ulnar nerve. So here, this is the superficial branch, this is the deep branch of the ulnar nerve, which is dividing at the proximal part of the hypothenar eminence. So the superficial part exits here before the deep part is going beneath the pisohamate ligament. Okay, and the deep part, as it passes beneath the pisohamate ligament and beneath the hypothenar muscles, it exits just medial to the hook of the hamate, being in the concavity of the deep palmar arch. So there is all possibility of the ulnar nerve being compressed here at the wrist or in the entry point of the Quion's canal or at the deeper part of the Quion's canal, resulting in pain, numbness and weakness affecting the medial 1.5 fingers and medial border of the palm as well. So in the palm, what is the course? Here you can see this is the flexor retinaculum. This is the distal border of the flexor retinaculum. This is the hypothenar eminence. So this is the proximal part of the hypothenar eminence where the ulnar nerve will be dividing into superficial and deep branches. Okay. So the superficial terminal branch, this one, where the termination of the ulnar nerve happens beneath the palmaris brevis, the superficial branch gives its supply to the palmaris brevis and then it divides into medial proper palmar digital nerve and lateral common palmar digital nerve. The medial palmar digital nerve, it supplies the ulnar side of the little finger. The lateral common palmar digital nerve, it receives a communicating branch from the palmar digital branch of the median nerve. After that, receiving the communicating branch, the lateral common palmar digital nerve, it divides into proper palmar digital nerves which supply the adjacent side of the ring and the little finger on the palmar aspect and onto the dorsal aspect of the middle and terminal phalanx of the ring finger and only terminal phalanx of the little finger. So this is the course of the superficial terminal branch. To see the course of the deep terminal branch, we will again look into the muscles of the hypothenar eminence here. So this is the palmaris brevis. This is the abductor digiti minimi. This is the flexor digiti minimi, beneath which has the opponent's digiti minimi. So to show the course of the deep terminal branch, the palmaris brevis, the abductor digiti minimi, the flexor digiti minimi are cut, and the opponent's digiti minimi is grooved. So this ulnar nerve, it passes through the Guillaume's canal deep to the abductor digiti minimi and flexor digiti minimi, pierces the opponent's digiti minimi, turns laterally onto the radial side of the palm below the hook of the hamate, beneath the all flexor tendons, within the concavity of the deep palmar arch, supplying most of the intrinsic muscles of the hand except the thenar muscles and first and second lumbricals. So if we see the supply of the deep branch as it courses beneath deep to the abductor digiti minimi and flexor digiti minimi, it supplies both abductor and flexor digiti minimi, pierces the opponent's digiti minimi, supplying that. This is the diagrammatic representation. So this is the hypothenar eminence with the hypothenar muscles. This is the thenar eminence with the thenar muscles. This is the first, second, third, fourth and fifth metacarpals, between which are the palmar and dorsal interossei, and these are the superficial tendons, the tendons of the flexor digitorum profundus, which gives rise to the lumbricals, the first and second lumbricals being unipinnate and third and fourth lumbricals being bipinnate. So as the deep branch of the ulnar nerve, after piercing the opponent's digiti minimi, turns laterally within the deep palmar arch, supplying the interossei muscles, all the four palmar interossei and the four dorsal interossei, and third and fourth lumbrical muscles, which are taking origin from the flexor digitorum profundus tendons, which are going to the ring and the little finger. It also supplies adductor pollicis, this one, and gives a branch to supply the deep head of the flexor pollicis brevis. So the muscle flexor pollicis brevis happens to be a dual nerve supply muscle, where the deep head is supplied by the ulnar nerve and the superficial head is supplied by the median nerve. And it also gives the articular twigs to the intercarpal joints, carpo-metacarpal joints and intermetacarpal joints and metacarpophalangeal joints as well. So this is what is the course of the deep branch of the ulnar nerve in hand, which can be a very important part of an essay question. So the overview here, it supplies, as we said, to the most of the muscles of the hand, or most of the intrinsic muscles of the hand, except the thenar and first and second lumbrical muscles. So these are the lumbrical muscles which are arising from the profundus tendons. Third and fourth, being bipinnate, are supplied by the ulnar nerve. First and second, being unipinnate, are supplied by the median nerve. So these are the four palmar interossei, which are all unipinnate. These are the dorsal interossei, which are all bipinnate. So the function of the palmar interossei are the adduction, the middle finger being the axis. So all the fingers move towards the middle finger. That forms the adduction movement. The dorsal interossei function is abduction. DAB, you can remember it like that. DAB functions. It is abduction. The fingers moving away from the middle finger, which forms the axis, is the abduction movement of the fingers, which is performed by the dorsal interossei muscles. To know about the function of the lumbricals, the lumbrical muscle flexes the metacarpophalangeal joint and extends the interphalangeal joints. This can be explained by this diagram here. If you follow, the lumbrical muscle and the interossei muscle, they are attached to the dorsal digital expansion, where the lumbrical muscles are taking origin from the flexor digitorum profundus muscle. They take origin from the flexor muscle and are getting inserted onto the extensor muscles, linking the flexor muscles with the extensor muscles. So these lumbricals are called as link muscles also. So if we take this as axis of a digit, as the lumbrical gets inserted onto the dorsal digital expansion, it spans from the base till the apex. So as the lumbrical crosses the metacarpophalangeal joint, which falls ventral to the axis of the digit, it helps in the function of the flexor digitorum profundus muscle flexing the metacarpophalangeal joint. At the distal part of the dorsal digital expansion, or the apex of the dorsal digital expansion, as the lumbrical is attached, it falls on the dorsal aspect of the axis of the digit, where it helps in the function of the extensor digitorum action, which is inserted onto the base of the terminal phalanx. That is the reason there is extension of the interphalangeal joints. So this is the main action of the lumbrical muscles. So the overview of the supply in the palm, because ulnar nerve supply in the hand is an essay question, part of the essay question. So the superficial branch of the ulnar nerve, it supplies, we are talking about the superficial branch, it supplies a muscular, it gives a muscular twig to the palmaris brevis, and then it divides into two proper palmar digital branches for medial 1.5 fingers. The medial palmar digital branch supplies the ulnar side of the little finger, and the lateral palmar digital branch, it divides into proper palmar digital branches supplying the adjacent sides of the ring and the little finger. It also supplies on the dorsal aspect of the terminal middle phalanges of the ring finger and skin over the terminal phalanx only of the little finger. The deep branch of the ulnar nerve, it supplies the hypothenar muscles, the forepalmar and dorsal interossei muscles, two limbrical muscles, adductor pollicis muscle, and the deep head of the flexor pollicis brevis, which is a dual nerve supply muscle. And the dorsal side of the medial half of the palm, it is having its supply from the dorsal cutaneous branch of the ulnar nerve. And the hypothenar eminence has its cutaneous supply from palmar cutaneous branch of the ulnar nerve. It also gives articular branches to the intercarpal, carpometacarpal and intermetacarpal joints. To see the summary of the ulnar nerve quickly, the ulnar nerve being formed as a branch from the medial cord of the brachial plexus, having the root value of C7, 8 and T1, of which C7 fibers are conveying to the flexor carpi ulnaris muscle only. In axilla, it runs between the axillary artery and axillary vein along with the medial cutaneous nerve of the forearm. Doesn't give any muscular branches in the axilla. In the arm, it lies medial to the brachial artery, and in the middle of the arm, it pierces the medial intermuscular septum, getting separated from the medial cutaneous nerve of the forearm. Accompanied by superior ulnar collateral artery, it pierces the medial intermuscular septum to course in the posterior compartment of the arm between the medial intermuscular septum and the medial head of the triceps. Even in the arm, there are no muscular branches. In the forearm, it enters into the flexor compartment of the forearm from the posterior compartment of the arm, lying on the posterior surface of the medial epicondyle and the olecranian process, lying in the cubital tunnel between the two heads of the flexor carpi ulnaris, enters into the forearm, resting over the flexor digitorum profundus, supplying the flexor carpi ulnaris and the medial half of the flexor digitorum profundus. It also gives two cutaneous branches, the palmar cutaneous branch supplying the skin over the hypothenar eminence and the dorsal cutaneous branch supplying the skin over the dorsum of the medial half of the hand and the medial 1.5 fingers. It gives an articular tweak to the elbow joint also. As it enters the palm, superficial to the flexor retinaculum, within the Guyon's canal, which is formed by a superficial slip of the flexor retinaculum, beneath the palmaris brevis, dividing into superficial branch and the deep branch. Superficial branch being cutaneous after supplying the palmaris brevis, then divides into digital branches to supply the medial 1.5 fingers and onto the dorsal aspect of the terminal and middle phalanges of the ring finger and only the terminal phalanx of the little finger. The deep branch supplies most of the intrinsic muscles of the hand except the thenar muscles and the first and second lumbricals. So it supplies the 3 hypothenar muscles, the 4 palmar interossei, the 4 dorsal interossei, 3rd and 4th lumbricals, adductor pollicis and deep head of the flexor pollicis brevis. So to conclude, let us just see the muscles the ulnar nerve is being supplied. In the forearm, it supplies the flexor carpi ulnaris, which also has its fibers conveyed from C7 root. Flexor digitorum profundus, the medial half of it, where its tendons go to the ring and the little fingers. It supplies the thenar muscles, which are the adductor pollicis and the deep head of the flexor pollicis brevis, the flexor pollicis brevis being a dual nerve supply muscle. And its supply to the digits, the muscles concerned with the fingers are the 4 palmar interossei, 4 dorsal interossei and 3rd and 4th lumbricals, and to the hypothenar muscles, which are the abductor digiti minimi muscle, opponens digiti minimi muscle and flexor digiti minimi muscle.